Hello and welcome to Health Watch. Today is Thursday. Remember, every Thursday we come on board on Meter Free Radio 89.6 in Boya to talk about health issues. Today we shall be talking about cancer. Our guest on Health Watch today is Nzi Eric Nga, palliative care nurse specialist, and he is the supervisor at the CBC Health Service Palliative Care Department at the Baptist Hospital in Mutengene. We shall be talking about issues relating to cancer. Health officials are advising that proper diet should be taken into consideration, tobacco consumption should be stopped, and alcohol intake should be reduced in order to stay off risk factors to contracting cancer. In the course of the program, we shall have our guest tell us what cancer is. He will also talk about the types of cancer, causes of cancer, symptoms of cancer. Also, our guest in the studio shall be telling us what the treatment options for cancer are, and also as a palliative care nurse, the services he offers to patients, as well as challenges he faces being a palliative care nurse. The team that is keeping you company this evening on Health Watch on Meter Free Radio is Tiku Evis. He is at the dashboard, and I'm your host on Health Watch today. My name is Frida, Leyina, VOMA, and Health Watch opens now.
Eric Nga. I am the supervisor of palliative care for the CBC Health Services and currently work at the Baptist Hospital in Mutengene.
Thank you very much, Eric Nga. You're welcome to Health Watch.
Thank you. It's my pleasure.
Today on the program, we are talking about cancer. People die every day of cancer. Tell us, what is cancer?
Cancer, in simple terms, is abnormal growth of body cells. It can choose to grow in any area of the body, and we are saying that the growth is abnormal.
So what are the types of cancer that exist?
Many types of cancers exist depending on the area that is affected. We can have cancer on the head as a head tumor, in the eyes, sometimes what we call retinoblastoma. We also have something like Burkitt's lymphoma, whose manifestation may present with swelling at the level of the jaw, in the abdomen. We know of breast cancer affecting both men and women. We equally have prostate cancer for the men. We also have colon cancer, which is something that is coming up also seriously. And recently, with HIV and other conditions, we have things like Kaposi's sarcoma, which is a kind of skin cancer which affects almost all parts of the body, and many others.
So what causes cancer?
It is actually very difficult to say exactly the cause of cancer, but we know that there are some factors that can predispose you to getting cancer, some of which are things like tobacco consumption. We have unhealthy diets. We have physical inactivity and use of chemicals, like including alcohol. Okay. Some of these things can predispose you to developing a cancer. Others are infections. Infections like the HIV can predispose people to getting some cancers. The human papilloma virus as well. and sometimes the H. pylori, which causes gastric in many people, that can also predispose people to cancer. So infections as well can do.
So what are some of the symptoms of cancer?
Like said, it depends on the type of cancer. And sometimes people who have cancer will just present with unexplained weight loss. So that if you observe unexplained weight loss, it is important for you to begin to check what is happening. Some also just develop fevers that we may not know the origin, where other common things are looked for and not seen. It is important to think it can be cancer as well. Others will have skin manifestations. It may be a swelling noted in one area of the body. It can also be like a mass or a nodule noted in one part of the body. Like, for instance, somebody with a breast cancer may observe a swelling in the breast. You may also have changes in the skin color. When normally your skin should be smooth and normal, but you see it looking like that of an orange, like you have been stung by a bee or whatever. Some of those things may be indicative of the fact that something is going wrong. For some people, like many people today, just think they have what we describe as pile or a hemorrhoid. They observe bleeding with stool. It may be indicative of something going wrong, especially along the intestinal tract. Most people with cancer of the colon will present as such. So it is important, if you see some of those things, it's just good to check. We may not have a specific thing to say this is exactly how cancer will present, but like I said, depending on the type.
Okay. Nzi Eringa, you are a palliative care nurse specialist at the Baptist Hospital, Mutangane. What are some of the treatment options for cancer?
Like I said, depending on the type, somebody can benefit from what we call chemotherapy. Chemotherapy is the use of drugs, cytotoxic drugs that can kill the cancer cells from growing. So this is administered to some of the patients presenting with cancers. Others will also receive what we call surgery. We may need to amputate the part, remove that area, and in that way treating the cancer. For some people, radiotherapy is given, where we use radioactive waves to kill the cancer cells, and this is done in Cameroon just at the General Hospital in Douala. So most patients, they may receive chemotherapy, they may receive the surgeries, and finally they are referred to have this radiotherapy at Douala so that it can also help. And some also go on what we call hormonal therapy. We give some hormones to help the patients to live on. For instance, a woman who has his or her breast taken off may need some hormones like tamoxifen to take daily to help with this situation. So those are the things that we do. And finally, when all of these measures maybe are not working, or alongside when we see the condition not being so curative, the aspects of palliative care will be moving along with the patients.
Okay, you are a palliative care nurse, a specialist to add. How can we clear the myth that people believe cancer is so deadly that it's like there's no treatment for it?
It is very true that cancer is killing a lot of people. If we look just in 2015, over 8.8 million people died from cancer.
The world over?
Yes. And over 14 million people are diagnosed with cancer every year. That number is huge. But the good news we have is cancer can be cured. If cancer is seen at the early stage, it can easily be cured. The only difficulty we have in our setting is people don't go for screening. People don't go to the hospital so that their conditions can be assessed early. And they only come when the symptoms are actually presenting, when they are actually at a late stage. And that makes it difficult for us. If we look at what is happening in the West, many people survive from cancer because they go for regular screening. But the situation in our country is actually very different because we wait until we start presenting with the symptoms. A woman presenting with symptoms of maybe very heavy bleeding because of cervical cancer or severe pains in the lower abdomen is often indicative of the fact that it is already advanced, and at that stage we may have little to do, as opposed to someone who walks in and is informed he has pre-cancer cells in the cervix that can easily be handled even here in the hospital.
All right, you are a palliative nurse. I want you to tell me, how do you offer your services to persons living with cancer?
Palliative care simply takes care of those who have disease conditions that cannot be cured. And when we look at cancer patients, most of them, because they equally come in their advanced stage, there is often little that can be done medically to them. But we understand that where cure is absent, care can always be given. So we spend a lot of time to offer care to these patients. If I use an example of a patient with a breast cancer, maybe a swollen breast with wounds on it, smelling, part of what we do is we spend time to tell the patient what is happening, let him know exactly what is happening, because if a patient understands, the patient and the family, this care is given to the patient and the family, when they understand what is happening, they can easily follow up with us. When they know this, we also spend time to see how we can handle their pain. Cancer at the initial stage will not ring a bell like malaria will present with headaches and fever. But cancer in its late stage will present with a lot of pain. What we do is we have drugs like oral liquid morphine, which is on the 3rd class of the World Health Organization pain control ladder. That is very useful for the management of pain, and we can easily administer this to the patients as we assess them so that they are pain-free. We also try to look at ways by which we can do the dressing change in such a way that the odor is gone. We try to work with the families to understand exactly what they are going through, because when a patient is sick, he's not an island. The family is equally sick. We want to know exactly what they are going through and seeing how we can address their situation holistically, not just looking at the patient in front of us. So regularly, daily basis, the patients come to us, we look at them, we tell them about their condition, we tell them about the treatment options depending on the individual and what he or she can benefit from. We are able to explain this, and we equally explore possibilities of supporting, sometimes financially, to see how their treatment can be given.
Let's have a musical break. I'll be right back.
Timo Frida, Karaye Makwa Garada, Ombe, Arambe, Give me wings like Red Bull. I'm gonna get that. calling mule. Shela ma bi mo. Shela ma shayo ma yo. I'm a fan sherry. Shela ma calling mule. Shela ma bi mo. Shela ma fire shayo. I'm a fan sherry.
You're welcome back. If you're just tuning in, this is Health Watch you're listening to on Media Freak Radio 89.6 in Boya. Today on the program, we are talking about cancer. And the minutes gone by, we talked about what cancer is, the types of cancer, as well as causes of cancer. Our guest is still in the studio. He is a palliative care nurse specialist at the Baptist Hospital in Mutengene. His name is Nzi Eric Nga. You're welcome back.
Talking about financial support and treatment options for cancers, how affordable are the treatment?
The treatment for cancer is not very affordable in our context because
HIV is almost free.
HIV is free.
Yeah.
Other treatments we take with other life-limiting conditions may not be as expensive, but someone who comes with a cancer may need maybe 8 cycles of chemotherapy, which if each is costing close to 70,000 francs, we see that it is much money. Surgery may be needed at the end of the day, and radiotherapy too is expensive because you have to leave and go over to Douala, look for a way to stay for over 6 weeks to receive this therapy. Often there is breakdown in those machines and it is challenging to the patients and the families. But in all, when we look at the fact that when you do this, you can have your life restored, we see that it is important for patients who have the cancers to go in for this therapy because you may spend close to $1 million, but you will have your life to live on. As opposed to the fact that many people keep saying cancer cannot be treated and people will wait until they come at a late stage and they are ready for treatment when it cannot really be given. So the bottom line is if somebody is able to come early and close to $1 million francs can be used and cancer will be cured. But one of the good news around the Cameroon Baptist Convention Health Services is the fact that we offer cancer treatment to children free. There is the program with childhood cancer that offers treatment free, especially to children. Children are precious and we understand that they have their own life to live. So treatment is offered to them free, something that can cost you $1 million. So the encouragement is just if you observe an abnormality on your body, rush to the hospital and you can be helped.
Talking about the children and cancer, I'm tempted to ask the age, the vulnerable population, the persons who are more vulnerable to have cancer.
Cancer can occur at any age. At any age. But a particular cancer that is more common in children, what we call Burkitt's lymphoma, often we see it between the ages of 2 to around 14. Yes. Average around 7. Yes, it's actually, that is the most common cancer in children and it's actually curable. The presentation, many people will just think a child has a dental abscess because it's more a swollen on the jaw or a swollen on the abdomen, or sometimes just changes in the nature of the testes where one is swollen and the other is not. These things, we just encourage people, if you observe them, it is important to come to the hospital early so that it can be looked at and hopefully handled. Cancer, like I said earlier, is abnormal growth of body cells, and this is done so rapidly. So when we delay with cancer, it can become really very dangerous because it has a tendency to multiply easily, fast, and also invade other cells of the body other than the place where it originated from.
All right. Eric Guy, you are a palliative nurse specialist. For how long have you been practicing?
I have been practicing as a palliative care nurse for 9 years.
Okay.
But I have been working as a nurse for 18 years.
Okay.
As a nurse, I got challenged seeing patients with life-limiting conditions who cannot be attended to by the doctors, the nurses around, and often it was just refer. And I was wondering where we are referring these patients to. And I thought that getting into palliative care, which is all about giving a holistic package, caring for somebody physically, socially, psychologically, and spiritually, can mean a lot to that patient. And so I decided to enroll into palliative care, where I did an initiator's course within the CBC Health Services. And in 2009, I was able to go over to Makerere University, where I obtained a degree in palliative care.
So what are some of the challenges you've been facing as a palliative care nurse?
One of the biggest challenge is to tell the patient he has a disease condition that cannot be cured. It is not good news presenting this to anybody, and many people will not want to accept it. So that is a challenge. But with good counseling skills, we are breaking through and helping our patients, not actually breaking them, so that they can continue to live on even with those disease conditions. One of the things also, like just made mention, the cost of treatment for cancer is really very expensive. Many people cannot afford for this, and it becomes very challenging seeing somebody in front of you that you think can benefit from care and you cannot offer it. That actually is a big challenge. And often, considering that most of these patients may have to live long with these difficult conditions, the families also get tired at some moment. That family support is not there, and it's actually very challenging. But in all, part of ways by which we are struggling to handle this challenge is, like I talked of the children's cancer program, they are able to give treatment for children free. But to some of the adults, part of what we are doing at the moment is we have engaged on a local fundraising, which we describe as Project 1000. With Project 1000, we are looking at the fact that people should willingly come in to sacrifice 1,000 francs, which can go a long way to relieve somebody's pain. When we look at the top pain control medication that we have, oral liquid morphine, the cost, 1,000 francs can give you drugs that will take you 2 weeks. But most of the patients are not able to afford this. So when we go on with Project 1000, we are saying individuals who are healthy should give without feeling pain, so that it can go a long way to assist these people who are in pain. And that is the way, one part of the ways we are struggling to handle the pain of those who are suffering. And one of the things that I should truly appreciate the CBC Health Board for is the fact that patients who are in severe pain are not driven from the hospital.
Okay.
We give them the pain control, even if they don't have the money. So that is part of how we are coping.
Let's talk about cancer prevention. Can cancer be prevented?
Yes, cancer can be prevented. There are ways by which we can prevent cancer, and one of the biggest ways to prevent cancer is by doing the vaccinations. If we look at cervical cancer at the moment, which is really something that is posing a lot of problems, there is a vaccine that the CBC Health Services also offers for the prevention of cancer of the cervix. This is something we have been looking for over the years and not having, but now we are proud to say we have a vaccine that can prevent cancer of the cervix. part of ways by which we can do is also to come to the hospital as early as possible, and equally to avoid some of the things. Like I said, we may not put a finger on the real cause, but there are things that can predispose us to cancer. There is heavy smoking. If we try to avoid that, we are equally avoiding cancer in another way. The chemical use, like heavy alcohol consumption, those are some of the things. If we can do exercises and eat healthy food, take a lot of fruits, a lot of vegetables, those are some of the things that can help us from developing cancers.
Okay, Nzi Eric Nga, you are a palliative care nurse specialist at the Baptist Hospital in Mutangene. We've come to the end of the interview, but before I leave you, I want you to give a message for the public.
The message I have for the public is that cancer is real and it is increasing daily, but there are simple things we can do to truly prevent it from having the ravaging effect on us. If we can do our prevention by taking the vaccines, that will be useful. If as healthy people, if we walk to the hospital for just a checkup, that will be very useful, because cancer can be identified just at this moment of screening, and we will be helped at that early stage. We should not wait until we come in with complications and it is difficult to handle. The fight for cancer can be achieved if we take our health seriously and go in for screening.
Thank you very much for talking to Health Watch.
You're welcome.
This is where we end today's edition of the program Health Watch on Media Freak Radio. In the minutes gone by, we talked about cancer, and our guest, Nzi Eric Nga, a palliative care nurse specialist at the Baptist Hospital in Mutangene, told us a lot about the disease cancer. He also gave a message to the population, the team that kept you company. We have Tiku Elvis at the panel mixer. I've been your host on Health Watch today. My name is Frida. Leyina, VOMA, and Health Watch closes now.